Eye care in children is a specialty by itself. At Shaker Eye Hospital, we have pediatric eye specialists. Children's eyes are very important because being young, they themselves do not know how to report to a doctor or for what conditions one needs to meet a doctor. All parents should get their child's eye examined at the time of getting them admitted to the school. And if they notice the child holding the book too close to the eyes, or going too close to the TV, or squinting the eye and complaining that he or she is not able to see the blackboard properly. In these videos, I am trying to educate you about how to take care of child's eyes.
Early diagnosis and treatment of vision problems help set children up for success. According to the American Optometric Association, the first exam should be administered at 6 months of age. Many pediatricians offer eye exams, yet these practices may not have the necessary equipment to properly assess your eye health. Therefore, it's important to schedule an appointment with an eye care professional. Since your child is limited in their ability to communicate any problems, your eye care professional has a special toolkit, a test to assess your baby's eyes development. The first test will measure pupillary response, which will determine whether the pupil reacts properly in different light conditions. The second test, called the fixate and follow test, will gauge how will your baby's eyes able to fixate on a single object and follow it as it moves. The ability to fixate on objects should begin soon after birth, while the ability to follow the object develops by 3 months. The last test is called preferential looking. Since children at age 6 months are not expected to be able to identify letters or numbers on a typical eye chart, specialized cards with stripes are used to attract your child's attention. Your eye care professional may perform a retinoscopy to assess the eye growth pattern and possible refractive errors such as nearsightedness, farsightedness, and astigmatism. Eye drops may be used to help perform these tests and allowing examination of your child's eye health. Your baby's first exam is an important step in ensuring optimum eye health and proper development. Remember to schedule your child's first comprehensive eye exam with an eye care professional as soon as possible. Children are more responsive to treatment when problems are diagnosed early, which is why it's important to make sure your child has regular comprehensive eye exams. The American Optometric Association suggests that children receive exams at 6 months, age 3, and just before they enter first grade. Contrary to most parents' fears, preschool-age children do not need to know their letters in order to undergo eye tests. Your eye care professional is trained to help children who may not be able to communicate if they are having vision problems. A series of tests have been specially developed for young children. The first test, called Leah symbols, while similar to your standard vision chart with letters, uses special symbols that are recognizable to young children. The retinoscopy test helps your eye care professional determine the eyeglass prescription if one is needed. Your doctor will shine a light into the child's eyes and measure the reflection as it hits the retina located in the back of the eye. This helps to determine if a corrective lenses is needed to improve vision issues, including nearsightedness, farsightedness, or astigmatism. The last test is the random dot stereopsis. For this test, your child will be provided with a pair of 3D glasses and asked to watch special patterns of dots. By observing the progress of the test, it can be determined how well the eyes work together as a team. All of these tests are specially designed to fit the development stages of preschool children and allow your eye care professional to make the best possible diagnosis. Early diagnosis will lead to proactive treatment to ensure your child has the visual skills needed for future success in learning. Have you ever corrected your child for sitting too close to the TV? If he or she is having trouble paying attention in school, these may not be behavioral issues but instead be related to poor vision. 5.52 When 80% of the information learnt in school is presented visually, poor visual skills can greatly impact the learning and development process. Visual skills that not only include near and distance vision, but also by teaming skills, eye movement skills, focusing skills, peripheral awareness, and eye-hand coordination. In order to prevent these issues from affecting development and learning, scheduling comprehensive eye exams throughout childhood is important. Visiting your pediatrician or a school nurse for vision screening may not be enough, since screenings miss about 60% of children with vision problems. Instead, it is best to visit an eye care professional to receive a comprehensive eye exam for a complete evaluation of visual skills. When should you schedule comprehensive exams? According to the American Optometric Association, infants should have their first comprehensive eye exam at 6 months of age. Additionally, exams should be scheduled in 3 years and just prior to entering kindergarten. Because of the relationship between learning and vision, many states will require an eye exam before entering school. For school-aged children, those without vision correction should receive an eye exam every 2 years, while those requiring vision correction need an eye exam annually or at your doctor's suggested interval. Following a suggested eye exam schedule can lead to an early detection and treatment of vision problems to prevent behavioral and learning-related issues from development. It is estimated 5 to 10% of preschoolers and 25% of school-age children have already developed vision problems. Early diagnosis will help protect the learning and development process. Your first line of defense is your eye care professional. Your child's first vision examination should occur in 6 months. Eye care professionals are trained in special vision assessments developed to overcome any potential barriers in young children, such as an ability to communicate or short attention spans. Not only do they test for refractive errors such as near and farsightedness, but they also administer exams to evaluate ocular alignment and test for the presence of eye disease. The longer a vision problem goes undiagnosed and untreated, the more the brain accommodates the problem and the harder it becomes to correct it. Neurological development division occurs until age 9. This means if problems such as misalignment and the inability to focus vision go undetected, development may be hindered. Following a recommended comprehensive eye examination schedule can uncover any existing problems early on, leading to prompt treatment and management in order to keep learning and development on track. The American Optometric Association recommends the first comprehensive eye exam to be administered at 6 months. Follow-up exams should occur at ages 3 and 5 for school-age children. An examination is suggested every 2 years unless vision correction is required. If this is the case, a child should be examined annually or your doctor's suggested interval. Together, we will work to ensure your child has the best vision possible.